Hello, everyone, and welcome to Official Suad for Nursing Assistant Skills and Education. As I promised you guys, today we're going to be talking about consumer rights and responsibilities in healthcare. Well, we're saying we're going to talk about the healthcare consumer, and the healthcare provider rights and responsibilities. So as you know, my name is Suad. My credentials are right in front of you guys. So let's continue. So when we are talking about consumer or healthcare consumers, we're talking either about patients or residents or client who me or you, whoever need healthcare services, it's a healthcare consumer. So some of those rights is advance directive, informed consent, client rights, patient's bill of right, involuntary seclusion, corporal punishment, grievance. And in the following slide, we're going to talk on each term individually. Let's get familiar with the word right or consumer right. For example, or citizen in the United States or in other countries have certain rights. For example, right to vote, healthcare. Consumer have right to ensure that they will receive a quality care. Those rights are documented in a different document depending on where the care is given. If the healthcare consumer is unable to read or understand, the law makes provision to ensure that he or she is informed of those rights. For example, if the document is written in English and the consumer does not understand English, then we make accommodation, maybe translated, maybe we bring a translator that will explain that paper to that consumer. If the consumer cannot hear, then there are visuals, accommodation, and so on. Most important, a document or the consumer have to understand his right and responsibilities before receiving care. As a healthcare consumer, I should be able to maintain an accurate health record and be ready to share it with your healthcare provider. Should be able to communicate openly and honestly with your healthcare provider or your caregiver. Healthcare consumers should be able to provide information regarding the past medical history, a family health history, a medication that is on. Should be able to inform the physician or the caregiver if they anticipate any problem with the prescribed medication or treatment. Um, should be able to learn how to manage their own health, such the time to take their medication, the time to go see a doctor, following up with appointment and medication compliance also. Not to forget that you should also be able to ask questions and clarification if you don't understand the treatment. Not only that, but as a healthcare consumer, you should live a healthy lifestyle and avoid unnecessary risk of illnesses or injury. For example, exercising, um, consuming healthy diet, avoiding tobacco and drugs, um, taking care of yourself, less stress. In addition, as a consumer, you have to accept the financial responsibility for payment of healthcare and providing information for insurance claims. So uh, most of people are aware of health insurance and the co-payment and the claims. So when you go to see your care provider or visit hospital, you're going to get a piece of paper to sign that you are responsible for financing your visit in case of your health insurance is enabled to. So there's a lot of responsibility for healthcare consumer. And not only that, and most importantly, is be responsible of yourself and your health and know when you have to see your care provider and you have to make those visits. And when it is necessary to go to the ER instead of going to your primary care provider. Most important things, which like we advise everyone to have a primary care provider, because having a primary care provider keep you up to date with your health and health record, and you avoid a lot of health sequelae that will just send you right to the ER. After we talked about healthcare consumer responsibilities, let's talk about healthcare provider responsibilities. Every person working in healthcare should be familiar with the documents that pertains to the facility they work in. Each of those documents is similar and emphasize the right of the patient, resident, or a client to be treated in a respectful and dignified manner. This includes the right to privacy and confidentiality. So those are very important terms and information that you should keep in mind the rest of your life. We have the patient's bill of right. So patient's bill of rights is given to a patient receiving care in a hospital setting. So in a hospital setting, we have a patient. So the document we give that person, a patient, it's called the bill of right. His right to be treated equally, fairly, with justice. His right to a quality care. So that document is a patient's bill of right. A client's right, as you hear the word clients, right, is given to a person receiving care in their home. So if person is in their home, he's a client, he's not a resident, and he is not a patient, is a client. And we spoke about this in previous presentation. Now, residents' right. Resident rights is a given to a person that is receiving care or admitted to a nursing home, a skilled facility, assisted living. So they are residents because they live there. They are residents. So the document called that provide their right is called residence rights. So we have the patient bills of rights, clients' rights, and resident rights. More terms to keep in mind and to be familiar with, especially if you're going to be a healthcare provider, a CNA, RN, LPN. So those are going to be your friend the rest of your career. Informed consent means that the consumer, either client, resident, or a patient, gives permission to receive care or the procedures, but after full disclosure of the purpose of the care or procedure, the benefit and risk involved. To make it like simple, before you receive care as a client, you have to know which procedure you're going to be given, which care you've been going to be given, which procedure you're going to go through, which care you're going to be given, and even which medication you're going to be given. Okay, so you have to understand that piece of paper that you're going to sign, and if you don't understand the language, then you have a right to get a translator or a translated document. They're also going to tell you the benefit of the procedure or the treatment and the risk of the procedure and the treatment. Okay, so you have to agree about the risk and the benefit and sign so you can receive that care. So that called informed consent. You give consent after we inform you about everything that's going to happen before it happens. Okay. So let's see advanced directive. It's a document that gives instruction about the consumer's wishes for treatment if the consumer is terminally ill or unable to communicate. Let's make it simple. Advanced directive. Okay, it's a piece of paper that have all your wish as a healthcare consumer, as a patient, as a resident, as a client. Okay, this is how I want to be treated when I'm really sick and I cannot make my own decision. I'm not able to do it. I want to be on ventilator. I do not want to be on ventilator. Life support. I want to be on life support machines, or I do not want to be on support. I want to receive a procedure. I want not. So advanced directive, if you are like able to make decision for yourself, you put it in a piece of paper. Okay, the attorneys general sign it for you and carry it with you to a healthcare facility or providers, so they know exactly what you wish when you're not able to communicate your wish. That advanced directive. Grievance is the situation in which the consumer feels there are ground for complaint. For example, if the client, resident, or a patient feels that did not receive a quality care, did not get the treatment that he was looking for, his privacy got violated, he has the right to grieve and file a complaint that goes first to facility. Then there are procedures that got followed to solve the problem. So that is grievance. Corporal punishment, which is a physical force, use of physical force. I hope does not happen, not even in a healthcare settings, but also all over. Like we don't want it to happen wherever. However, it's like when you exert force and you touch physically another person, like battery or like shaking. So that is a corporal punishment. And voluntary seclusion or isolation of a resident or a patient without a medical reason. So if there is a seclusion or restraint, so we need a doctor order for seclusion, and it happened when a patient is at risk to harm self or to harm others. So we need a medical order for a seclusion and restraint, seclusion and or restraint. Um, but just secluding or a patient or resident for nonsense because he's acting out without a good reason and without a doctor order, that's against the law. It's not good. A chemical restraint also is when you medicate a patient with medication that put him to sleep. So a chemical restraint, or just keep them like a zombie. That's a restraint. So many patients like behavior one, a psych, they're not aware of what they are doing. And you see now, wow, I have so many patients, I can deal with all of them. Then you push medication to just have them sit down without moving or sleeping. That's a medical or chemical restraint, and you don't do a chemical restraint or physical restraint without doctor order. And the only reason you can do that when the patient or the individual is at risk to harm self or harm others, or we're not able to provide treatment. Like we have patients that pulling out IVs, that they're trying to jump out of the bed and they are not able to stand on their own. They are not aware of the environment. So we need a medical order to restrain or to seclude. So we talk about health care consumer responsibilities, healthcare provider responsibilities. Now the healthcare consumer rights, and we know that there are different rights and that they have to be aware of and to sign before receiving treatment or get admitted to any kind of healthcare setting. So the patient, the resident, the client, they have right to refuse treatment. They have the right to choose what they want to be done with their treatment. They have right for privacy. They have right to know their medical records and to see it, and they know what's going on. They have right for confidentiality. We're not sharing patients or resident or client information between us in the elevator. We're not sharing it in the dining room. We're not sharing that with people. They're not part of that team that provide care to that patient. And they have right to complain or grieve if they've been abused. And abuse can be like physical abuse, can be emotional abuse, can be financial abuse, neglected, if they need to be changed, if they ask for water and you forget to get them water or you do it on purpose, misappropriation of property, if get lost their stuff in their home or in where they live. Okay, they have right to grieve, they have right to complain, to file a complaint. They have a lot of rights. Now we are in this part, which is like kind of quiz, and we'll start always. If you watch my previous presentation, I have a part 2 of false and multiple choice questions, which I do love, and I like to go through them with you right now. True or false? The rights of healthcare consumer are important only to patient in hospital. Repeat, the right of healthcare consumer and important only to patient in hospital. What, as we said, healthcare consumer can be in the hospital, can be in the assisted living, can be in skilled nursing facility, nursing home, can be at home too. So the rights of healthcare consumer are important not only to the patient in hospital, they are important for all consumers, okay, for patient, for resident, and for client. So that statement is a false. So all United States citizens have certain rights that are guaranteed by law. Yes, that's true, such as right to vote. The third one, the client's bill of rights is given to a person receiving home care. Client bill of rights is given to a person receiving home care. Yes, he's a client. He's not a resident in a nursing home. He's not a patient in a hospital. That's true. Our second part of the quiz, multiple choice questions. Residents' rights are given to a person before they are admitted to. Resident, right? We give that to a person before admitted to. Home care, that's client. Skilled care facility, let's skip that. The hospital, that is a patient. Hospice services, we didn't talk about it. We'll talk about it in the previous presentation. So resident rights are given to person before they are admitted to a skilled care facility, comma, nursing home, comma, or assisted living. So the answer for this question is B as in boy. Let's get the second question or multiple question. All type of consumer rights state that the consumer has the right to be treated in a respectful, dignified manner, select individuals assigned to provide health care to them, private duty nursing care if desired by the patient or family, withhold personal information describing his or her medical condition. So we're talking about consumer rights, the document of consumer rights, and we see all type of consumer rights. Okay, we have patient bill of right, we have client's right, the same document, different setting. And we have client bill of rights. So our three documents, they all talk about the same thing, but different setting. They all talk about that health care consumer be treated in respectful, dignified manner. The answer for this question is A, is an apple. The purpose of advanced directive is to A, allow individuals to give instructions about their care should they become unable to do so. B, give individuals the right to choose their caregivers. C, provide a resource for resolving conflicts. D, permit the physician to prescribe treatment without conferring with the individual. This is a very good question. And as you see, all the options sound correct. So as we said, or we learned about advanced directive is the document that allows individuals to give instruction about their care when they are unable to speak up on their behalf. They are sick, they are ill. They already have the document in their medical file that will tell the healthcare provider what should they do. Okay, so A as an apple is the answer for this multiple choice questions. Healthcare consumers are responsible for leaving their bad habit at home when they are admitted to healthcare facility, reading and studying a medical book to learn all there is to know about their conditions, making treatment decision in keeping with their physician wishes, Communicating openly and honestly with their physician and caregivers. Let's talk about each one individual here. So healthcare consumer could be a client, could be a resident, it could be a patient. We're not asking you to leave your bad habit at home because now you need to be a good person because you came here. I'm not punishing you because you're sick or you're ill or you need my help. So option A is wrong. Option B, reading and studying medical book to learn all there is to know about their condition. Not really. You don't need, why there are doctors here? Why they are like healthcare provider? You do not need to. So you're here to receive a care fairly and with justice. Making treatment decision in keeping with their physician wishes. No, you don't make your physician happy. It's not what your physician want. Your care plan is you have to agree about it. It's what you wish. It's not what your doctor wish. The doctor will tell you, your care provider will tell you what is the treatment, what is the treatment, the options, and you're going to choose which one you think is right for you with the help with your physician and your healthcare provider. So D is communicating openly and honestly with their physician and caregiver. Yes, you need to be honest. You need to be open to discussion with your caregiver and your physician.